My name is Alyssa Benton, and today I'll be performing IV Star as well as hanging fluids. Throughout this process, I'll be following my GPSP protocols, as well as my 11 rights and my 3 checks, and my 2 patient identifiers. So I would knock, identify myself, and ask the patient for their name and date of birth. I would check their wristband and make sure everything matches, and I would assess for any allergies I need to be aware of. Now that I have done that, I would do hand hygiene, and I'm going to spike my bag. So I will take my cap off. I will get my primary tubing. I would take this cap off, make sure that nothing touches the weight. And I would push down and turn. Once I have done that, I would hang the fluids up, and I would fill the chamber halfway. Okay, now that I have done that, I'm going to prime my line. I'm going to take this cap off, and I would unclamp the tubing. This is just checking to make sure there is no bubbles in the line. Once I have done that, no bubbles are in the line, then I'm going to clamp it again and put the cap back on. All right, so now that I have done that, I would perform hand hygiene and don on clean gloves. So now I'm going to prime my J-loop. I'm going to take it out of the package. Going to flush it with saline. Going to turn that. Going to flush it. Okay, that is all good. And now I'm going to put it back into the bag, so that it does not get contaminated. So now that I've done that, I'm going to find my vein. I'm going to palpate to see which one I like. Okay, I found the one that I think I'm going to do. So now I'm going to get my tourniquet. Now that I have done that, got my tourniquet, find my vein, I'm going to check the radial pulse is good. Now I've done that, okay. Now I'm going to clean my site. And now I'm going to get my needle ready. Okay, once I have opened that package, make sure that my catheter is ready. I'm going to make sure that my bevel is up. I'm going to find it, place it in at a 10 to 15 degree angle. I would slide my catheter in, and I would take the needle out, and I would put the safety on and put it into the sharps container. And I would keep a hold. I would take the tourniquet off, and now I will be placing my J-loop on, making sure I do not touch the site the whole time. Now that I have done that, I'm going to pull back for blood return. All right, I see blood, and now I'm going to flush. Once I have done that, I'm going to tape off. I already have my tape ready. tape off the J-loop. I can take my finger off now that I have taped that down, and this is when I will put my Tegaderm on. I will place my Tegaderm over the site. Once I have done that, that is all good. Now I'm going to tape my J-loop, place it to the hand just to make sure everything stays. Okay, now I will unhook my solution. And this is when I'm going to scrub my hub. And now I will be hooking on my fluids. Take off the cap. I have already scrubbed the hub, and I'll be placing my fluids. I will make sure that it is unclamped and at the correct flow rate, making sure that there is no infiltration, everything is flowing correctly, making sure the patient isn't in any pain at all. And once I'm done with that, I would take my gloves off, I would perform hand hygiene, and I would report and record.